segment is sponsored by GBMC Healthcare.
So summer camp is a fun time for many children, but this summer, parents are considering the risk and contemplating whether to have their child attend summer camp due to COVID. So joining us to talk about summer camps is Hyde from GBMC. All right, so help us out here. Can summer camps be safe for kids? And if so, what are the biggest things that parents should consider when picking a summer camp for their child?
Yeah, so summer camps can definitely be safe for kids as long as the camp is taking a science-based approach to reducing the risk of COVID. The biggest thing for parents to look at is the environment of the camp. So is it an outdoor camp or is it an indoor camp? Because if it's an outdoor camp, the risk is going to be far lower for COVID transmission. Now, if it is an indoor camp, they do want to make sure that the camp is requiring masks for anyone who's not vaccinated.
Yep, that was my next question. What kind of safety protocols should parents look for?
Yeah, so they really should be making sure that the camp is following all kind of the public health guidelines that we've been following for the past year and a half now. So making sure that people who aren't vaccinated are wearing masks, especially indoors, making sure that they are disinfecting any shared equipment that the campers are using. They really want to be cohorting the campers into small groups to reduce the number of people that each kid is exposed to. And then, asking, is the staff vaccinated, and those sorts of things.
Okay, so at the end of May, the CDC eased the summer camp guidance saying that kids don't always need masks, but what are your thoughts on this? And then what advice do you have for parents about masking their kids?
Yeah, so I think right now, today, it is safe for kids to be outdoors without masks on. And that's because the risk of COVID transmission is very low right now in Maryland. So Maryland has less than 1 per 100,000 people, so 1 case per 100,000 people. And we are designated by the CDC as a low transmission state. And so there's a low risk of transmission outdoors, and there's a low probability that your child will be exposed to anyone who's positive for COVID. So putting those two things together make for a very, very low risk scenario. It's not zero, but it is very low. Now, indoors is another story because the risk is higher indoors. So you do want to make sure you're sending your kid to camp with a mask and make sure that they are wearing it anytime they go indoors.
Okay, so should parents have their kids tested or check for symptoms before camp? And then if so, what kind of symptoms should they be monitoring at home? How often should they check?
Yeah, so they definitely want to be doing a daily symptom check. So every morning before you send your kid to camp, you just want to make sure they're feeling okay. Check to see if they have a fever, make sure they don't have any respiratory symptoms like cough, difficulty breathing, runny nose. And you also want to make sure that they don't have symptoms of any other infectious disease as well, because you don't want to spread anything to the other campers. If they do have symptoms of COVID, such as cough, fever, shortness of breath, congestion, sore throat, it's a good idea to get them tested. Obviously, don't send them to camp. If you're not sure about testing, give your pediatrician a call and they'll be able to assist.
All right, such great information, useful and certainly timely. We appreciate you being here with us today.
Thank you for having me.
Thank you.